Standard Occlusion Theory for TMD. I am Sotokawa, a dentist practicing in Morioka City, Japan. This theme covers the occlusion theory essential for treating temporomandibular joint disorders, organized into the following 24 topics. This time, I will explain the 7th topic. Centric Relation. 7. Centric Relation. Contents. 1. What is centric relation? 2. Understanding of centric relation. 3. Method for determining centric relation. 4. The intercuspal position coincides with the centric relation. 5. The intercuspal position and centric relation are misaligned. 6. The significance of mounting the model in the centric relation on the articulator. Summary. 1. What is centric relation? Dawson discusses centric relation as the most important theme throughout chapters 7 to 11 of Functional Occlusion. The centric relation is the positional relationship between the upper and lower jaws when the temporomandibular joints are in their most stable state. It is not a position where the mandible is fixed. Rather, as shown in the illustration on the right, it is the positional relationship of the mandible relative to the maxilla where the condyles of the mandible are seated in their respective mandibular fossae in the most stable position, allowing the mandible to perform stable rotational movement around the left and right temporomandibular joints. Given Dawson's extensive, detailed explanation of centric relation spanning numerous pages, mastering all discussions on this topic is no easy feat. However, once a dentist understands the concept of centric relation, it is not difficult to examine and diagnose patients suffering from malocclusion as described in functional occlusion, and then modify the patient's occlusion to a state suitable for centric relation. Patients who achieve an occlusion suitable for centric relation will immediately state, "My bite feels easier." Please learn about centric relation and help patients suffering from malocclusion. 2. Understanding of centric relation. The concept of centric relation, introduced by Schuyler in 1935, has been debated by numerous researchers, with various definitions and methods for its acquisition proposed. However, the fundamental concept that centric relation is the most appropriate mandibular position controlled by the temporomandibular joint, unaffected by tooth occlusion, has remained unchanged from when Schuyler introduced it to the present day. Understanding this fundamental concept is paramount. In his writings, Dawson states, "The centric relation is the most important factor in occlusion. Determining the centric relation is the most essential skill required for occlusal treatment. Confirming the centric relation is indispensable for the differential diagnosis of temporomandibular disorders. Accurate recording of the centric relation is crucial for performing the most economical, efficient, and problem-free restorative and prosthetic treatment." 2. Understanding of centric relation. The concept of centric relation, introduced by Schuyler in 1935, has been debated by numerous researchers, with various definitions and methods for its acquisition proposed. However, the fundamental concept that centric relation is the most appropriate mandibular position controlled by the temporomandibular joint, unaffected by tooth occlusion, has remained unchanged from when Schuyler introduced it to the present day. Understanding this fundamental concept is paramount. In his writings, Dawson states, "The centric relation is the most important factor in occlusion. Determining the centric relation is the most essential skill required for occlusal treatment." Confirming the centric relation is indispensable for the differential diagnosis of temporomandibular disorders. Accurate recording of the centric relation is crucial for performing the most economical, efficient, and problem-free restorative and prosthetic treatment. 4. The intercuspal position coincides with the centric relation. The occlusal contact position is the mandibular position where the upper and lower teeth make stable contact at the greatest number of points. On the other hand, the centric relation is the mandibular position where the left and right condyles achieve the most stable position within the glenoid fossa. Therefore, in a single patient, two mandibular positions can be obtained: the occlusal contact position and the centric relation. In normal occlusion, as shown in the illustration on the right, when the mandible is returned from an eccentric position to the occlusal contact position, the occlusal contact position and the centric relation position coincide. In this case, food can be chewed firmly while the temporomandibular joint remains stable. That is, when the occlusal contact position and the centric relation position coincide or their difference is minimal, it is considered normal. 5. The intercuspal position and centric relation are misaligned. As shown in the illustration above right, when the occlusal contact position and the centric relation are misaligned, the mandibular condyle deviates from the centric relation during occlusal contact. If the mandibular condyle is moved to the centric relation, the upper and lower teeth will deviate from the occlusal contact position, resulting in only some teeth making contact. Consequently, the temporomandibular joint and teeth will experience various stresses and impairments. In other words, confirming the positional discrepancy between the centric relation and the occlusal contact position provides dentists with crucial information regarding temporomandibular joint disorders. Furthermore, since the centric relation is the reference point for mandibular movement, the direction and extent of deviation from the occlusal contact position must be determined relative to this reference point. That is, if a dentist cannot confirm the centric relation as the reference point, they cannot understand the mandibular movement itself, let alone record it. 6. The significance of mounting the model in the centric relation on the articulator. Dawson states the purpose of mounting models on an articulator for centric relation in functional occlusion as follows. A. To determine the positional relationship of the mandibular dentition relative to the maxillary dentition when the condyle is in centric relation. B. To determine the optimal treatment plan for achieving dental harmony with correct jaw relationships. C. To evaluate all treatment options, including occlusal adjustment, orthodontics, restorative dentistry, and oral surgery. Specifically, it allows observation of malocclusal conditions in centric relation. Furthermore, by performing trial occlusal adjustments on the model, it is possible to predict the post-treatment occlusal state. Summary. Dawson, in functional occlusion, presents the following 5 criteria as requirements for the mandible to be in centric relation. A. The articular discs are properly positioned over both condyles. B. The condyle disc complex is at its highest possible point, contacting the posterior oblique surface of the condylar tubercle. C. The medial pole of the condyle disc complex is supported by bone. D. The lower head of the lateral pterygoid muscle is relaxed and not contracted, remaining passive. E. The temporomandibular joint can accept strong pressure loads without exhibiting signs of tenderness or tension. Understanding these 5 criteria enables dentists to establish the patient's centric relation, perform occlusal analysis and diagnosis, identify and resolve malocclusions, and achieve complete recovery from temporomandibular joint disorders. Dentists who understand the centric relation can help patients suffering from temporomandibular joint disorders and personally experience the joy of patients who have been completely cured. Standard occlusion theory for TMD. 7. Centric relation is now complete. If you enjoyed this topic, please click the like button. If you have any questions or concerns, please write them in the public comment section below. The next topic is the 8. Determining centric relation.